My name is Sam Meisler, and I'm a small animal veterinarian. In this segment, let's talk about dog seizures. Now, if your dog has had a seizure for the first time, it can be a very frightening experience. Usually a seizure starts out with a repetitive movement of one muscle in the body and then progresses to a generalized seizure where the whole body is convulsing. Sometimes at the end, a dog will lose control of its bowels and go ahead and urinate. Some of them will even be nauseous afterwards and vomit. When a dog comes into our office with a history of having a seizure, the first thing we want to do is do a blood workup. Now, the reason we do a blood workup, we're looking for causes outside the brain that might lower the seizure threshold and cause your dog to have a seizure, like kidney disease, diabetes, liver disease, that sort of thing. We want to rule that out first. If that blood work is normal, then the seizure has originated inside the brain. Causes of seizures that originate inside the brain, most common cause is epilepsy, either inherited epilepsy, which usually occurs at about age 2 to 3, or acquired epilepsy, which can happen at any date, any age. Other causes are different viral diseases, some inflammatory diseases, and rarely even a brain tumor. If the blood work's normal, and we've narrowed it down to the brain, the next step is, if finances can afford it, is to do a CAT scan or MRI. That test will rule out a brain tumor. I mean, that's really the only test we can use to actually determine whether your dog has a brain tumor. A lot of people cannot afford this step, and at that point, we usually stop diagnostics if they can't afford that step and decide whether to put the dog on anticonvulsants to control the seizures or not. If a dog's just having a seizure every month or so, then I'm less likely to put it on an anticonvulsant. If it's having seizures every week, then I'll put it on an anticonvulsant. If it's the first time it's had a seizure, then usually if the dog's otherwise normal, blood work's normal, everything's looking good, I'm going to wait and see what happens. And if it, again, starts having seizures very frequently, we'll put it on an anticonvulsant. Another indication for putting your dog on an anticonvulsant is if it's having seizure clusters or seizure storms. Your dog may go on for a week or two without any seizure at all, and then one afternoon have 6 or 7. If that happens, then we're going to go ahead and put your dog on an anticonvulsant to prevent that exhausting series of seizures occurring. This gives you a basic idea of what we look at in seizures. There's a lot more to it, but at least that gives you a basic introduction to the causes and what we do about dogs who have seizures.